Hey guys, welcome back to the channel. As you know, recently in the PM debate between Rishi Sunak and Liz Truss, the host Kate McCann fainted, surprisingly, and the most likely reason for this must have been a vasovagal syncope or a simple faint. In this video we will look at more about the physiology of a vasovagal faint, the signs and symptoms, and its management. Medical emergencies can happen within a dental scenario, so as dental professionals we need to be prepared to handle them. According to studies conducted in the US and Canada, syncope is the most frequent medical emergency that dentists will encounter. So what is a vasovagal syncope? Well, it's known as a simple faint, where the patient will have a brief loss of consciousness known as syncope. And this is frequently caused by insufficient blood flow to the brain. Passing out or fainting are other names for it. The heart doesn't pump enough oxygen to the brain and blood pressure is too low, hypotension, which is when it most frequently happens. It might be harmless in most of the cases, or could be a serious sign of something more sinister. Syncope is a symptom that can have a variety of causes, from non-life-threatening illnesses to serious ones. Numerous non-life-threatening conditions include excessive heat, dehydration, profuse sweating, exhaustion, blood pooling in the legs as a result of abrupt changes in body position, can all cause syncope. Certainly, fear and anxiety are frequent causes of syncope in dental patients. The most prevalent type of fainting is neurally mediated syncope, known as NMS, which is a frequent cause of visits to the emergency room. Reflex neurocardiogenic or vasovagal or vasodepressive syncope are additional names for it. It is a benign and infrequently needs medical attention. The good news is that a patient who experiences syncope will probably recover very quickly. Neurally mediated syncope can happen at any age, though it's more common in children and young adults. It occurs when a trigger, such as emotional stress or pain, causes the area of the nervous system that controls blood pressure and heart rate to malfunction. Some of the signs and symptoms of syncope include fainting, pale skin, lightheadedness, tunnel vision, where the person can only see what is directly in front of them, nausea, and dizziness are all indications of syncope. How do we manage someone who has fainted as a result of a vasovagal syncope? Well, we need to stop any type of treatment that we're doing initially. We need to determine the patient's level of consciousness by observing how they react to sensory stimulation. We need to inform the rest of the team and call for assistance, make sure oxygen is on standby, and any other emergency drug is also present. The patient should ideally be placed in a supine position with their feet slightly elevated. Assess the patient's airway, breathing and circulation. Adjust the jaw and head position as necessary. Check the patient's pulse and blood pressure as well. Provide oxygen if necessary and keep track of their vital signs, and hopefully the patient should come around pretty soon. Well, thank you very much for listening. We hope you find this video beneficial. If you have, then please like the video. It really helps the channel grow further, and we'll be bringing more videos for you in the near future. Thank you very much again. Bye bye.